My name is Ailish and I'm a Chartered Physiotherapist with the Bump Room, and you're watching a video blog that we are doing on the Bump Room's top 3 exercises for pelvic girdle pain. So as you may have seen in the previous blog that we did on pelvic girdle pain, I just shared my experience of having pelvic girdle pain. So I'm currently 20 weeks pregnant on my 3rd baby. So these exercises are the ones that I found really helpful with my pain. Okay, so the first one, you need to have a gym ball. Okay, so I just have a gym ball here and I'm going to sit on the ball. Now when you sit on a gym ball to do exercises for your pelvis, you should sit so that your hips are higher than your knees. Okay, so you need to have a ball that is big enough for that. It might need to be inflated a little bit more, but a quick check just to make sure your hips are slightly higher than your knees. Okay, so I'm just going to show you from the side because it's just really nice to see. See the way my hips are just slightly higher than my knees. Okay, that's all you need. If your hips are lower, the exercise won't be as effective. Okay, so my number 1 exercise is pelvic rolls. Okay, so basically I'm sitting up nice and tall on the ball and I'm just going to roll my pelvis around in circles. So what I say to women in my classes is imagine that your tailbone is stuck in the ball, okay, and you're drawing a circle with your tailbone, or like you're stirring a pot with your tailbone, okay, just rolling around. And you really want to try and make them nice big rolls. Okay, so another thing to think about is as if you're doing a belly dance on the ball. Okay, so nice big circles. It's an inhale as you go around to the back, and then an exhale as you roll forward to the front. And if you want to be really good about it, you can release your bump as you go around to the back, and then hug your bump in as you roll forward to the front, just so that you're using your tummy muscles as well. But you don't have to do that. You can just do your rolls and then change direction. So you can do this in the evenings, pop on your ball for a few minutes, or even you can have it in front of your computer, and it makes a huge difference. So these are the pelvic rolls. Okay. So the next exercise, so exercise number 2, are pelvic tilts. Okay, so for that I need to get down onto the mat. Okay, so I'm just going to come down into my hands and knees now onto the mat. So hands and knees. Now sometimes before I do the pelvic tilts, I just like to kind of warm up with this movement. So I just open up my knees slightly, walk my hands forward slightly, and I'm just sitting back towards my heels, bump falls between my legs, and then up towards my hands. Inhale as I go back, exhale as I go forward. Okay, and then pelvic tilts, just pop those knees underneath the hips, walk the hands back a little bit, and then for this you take a breath in as you release your bump, and then as you exhale, tuck your tailbone under, hug your bump in. Inhale, release it. Exhale, tuck your tailbone under. So the only part of your body that's moving is your pelvis and your lower back. Your arms aren't moving, your legs aren't moving. It's just your pelvis. Sticking your tailbone out, curling your tailbone under. So often when I see women do this in the classes as well, they kind of have their heads hanging. So I encourage them just to keep their neck long in line with their spine. This is a really nice exercise as well for pelvic pain. Okay, and then the last exercise that I recommend for pelvic pain, we just have to pop onto our backs for this. So as usual, nice and slowly coming down onto the mat when you have pelvic pain, rolling on my side, pushing through my elbows, pushing through my feet. Okay, and now I'm going to do an exercise where I pop one leg in, the second leg in, my hands are on top of my knees, and I'm just rolling around my hips, so tiny little circles. These are called, I call these hip circles, or hip rolls. So all those exercises that we did are really kind of mobility exercises, because when you have pregnancy-related pelvic girdle pain, you just tend to get very tight, okay, and you just need something to help you loosen out a little bit. Just while we're here, another quick stretch. My pelvic pain is on my left side, so I'm just going to show you. I'm going to cross my left ankle over my right knee, And then with my hand then, I'm just going to push down my leg. This is just to give a little stretch to all those muscles around the hip. Okay, so those are the 3 exercises for pelvic pain. Number 1, pelvic circles. Number 2, pelvic tilts. Number 3, the little hip rolls. And if you want, you can throw in that stretch at the end. There's loads more exercises, but they're the top 3 at the moment. So thank you for watching, and if you want to subscribe to more, just pop onto the website, thebumproom.ie.